To our top story here, it's a treatment that has been around for more than 350 years. And for decades now, pressurized oxygen tanks, they've been used to heal burns and snake bites and diabetes skin ulcers.
But what's still controversial is whether these tanks can heal brain injuries. It's not stopping parents, though, from seeking help from a local doctor who says it works. Meg Ferris has tonight's special medical report.
These two families may live 2,000 miles apart, but they share the same devotion, love, and commitment to the children they adore and will do anything for. Both Sophia Lorenzi and Adonis Jefferson, each around 2 years old, suffered severe brain damage and were given no medical hope to survive.
The doctor came in and said, I'm sorry, we're gonna have to terminate the code, that there's nothing else that we can do for baby Sophia at this point. We try everything.
For them first 2 weeks, they kept telling me he wasn't going to make it. He's not going to come off oxygen. He's not going to be able to do this. He's going to be a vegetable.
Now both the Lorenzis from California and the Jeffersons from Marrero hope to see some progress in healing using hyperbaric oxygen treatments from Dr. Paul Harch in Metairie. Both families were highly discouraged by medical professionals to have the treatments.
There's not enough studies, proving that it's a fact, and they say that they don't want to sue us, waste their money in that because they know it's expensive. So
it won't be worth it. It's a waste of money. It's a gimmick. It's a scam. It won't work for him. His brain is damaged. You can't repair it.
Each family sought the weeks of daily treatments in the pressurized oxygen tanks after seeing our Medical Watch stories on improvements in other children from around the U.S. and even around the world. Like this child who drowned and was given a 5% chance at survival. Now back home in Morocco, his doctors there were stunned to see on scans the treatments reversed his shrunken brain and the growth of new tissue. So the Lorenzi family temporarily moved the entire family to New Orleans from Lodi, California for the specialized treatments. In February, Sophia was pronounced dead after an hour and a half of CPR. She was unresponsive after falling in a hot tub while playing with her 5 older siblings.
And I just grabbed her and I screamed. It was very loud, a desperate scream, for help.
I just approached her and hugged her and saying, at the same time saying goodbye, but also in denial and also saying, no, Lord, you need to come back and bring her back, and just praying.
Then nearly 20 minutes after all medical care was stopped in the hospital, a nurse noticed Sophia began breathing.
They blew their minds. That's the word that they use, because how good Sophia was. For being without oxygen for that long, for being without a heartbeat for over 2 hours.
For Adonis, his condition started with his premature birth, a heart defect, and a severe brain bleed.
I was scared. Basically it was the emergency C-section, and when they held him up to me, I'm like, he's not pink, he's blue. He wasn't crying. He had to be transferred to Children's because he had to be intubated. He came out not breathing. He had to be resuscitated. They weren't sure how long he was without oxygen.
Then an even more frightening phone call from his surgeon.
I need permission to have surgery on your son or he's going to die. I was at a loss. He was like, look, I'm telling you this because his bleed is so severe, his brain has shifted.
Brain cells communicate, do their function by emitting electrical impulses. So they are in electrical silence, but they are not dead.
Dr. Harch says hyperbaric oxygen treatment will not revive dead brain tissue. It's treating neurons that are stunned or crippled from the injury. He cites one case study of a patient 16 years after a stroke.
They showed with brain imaging, before and after one hyperbaric treatment, that in what appeared on CT scan to be the densest area of dead brain, it lit up with metabolic function. And they said these neurons have been idling for 14 years.
He says studies show multiple treatments with a specific dosing of pressurized oxygen stimulate stem cells, Genes dealing with growth and repair hormones are turned on and off. Why do you think so many doctors still discourage patients from getting this after stroke, after TBI, after all that?
Because it violates a belief system in medicine. And the belief system is based on what my generation of doctors was taught, that you can't do anything for a brain injury, a brain problem. The brain has to heal itself.
Hey, Adonis.
While Dr. Harch cites studies and other brain experts cite a lack of studies, these families, now about halfway through weeks of treatments, are moving forward at their own expense of time and funds.
He's babbling more. He's saying no more frequent. No is his favorite word. Last night he slept through a night.
Never happened before.
Never.
We're so glad that we made it over here right after her discharge from the hospital. And we just see so many changes on baby Sophia since day one.
Sophia is showing a tremendous change. She's sleeping through the night, can now swallow and eat by mouth, not the feeding tube. Her stiff, locked tongue is gone, and she can now respond to conversations and track. The tight-locked fists and knees are now flexible. And the most important thing, she's smiling.
If they show a response like this, it means that they will continue to respond on a longer-term basis to additional treatment.
And sometimes a parent just wants the baby steps.
For him to be able to hold a bottle on his own. I want my son to be able to hold a spoon. Like, that's quality of life for me. He doesn't have to be able to read me a book or run down the street. But if he can just say, that's my mom. The small things is what matter to me.
Meg Farris, Eyewitness News, Medical Watch.
80 to 85% of patients will respond to the treatment. Very severe cases do not. Some go on to have more improvement afterwards using a portable tank at home. We have links to the family's GoFundMe pages on our website.